Hold still. Hold still, hold still, hold still. Yep. No, you're a pretty feisty zombie, alright. Good thing I'm feistier. Alright, now that we've got you stuck, so you can't move. No. Stop while you're wiggling. Okay, calm down. You're gonna be okay. You're gonna be okay. I've gotten really good at curing zombies. It just takes a little bit. But first, let's figure out a little bit what's going on. Make sure you've no other injuries. Because the worst thing that can happen is when you cure a zombie and then the person instantly dies because they needed that virus's special healing factor to help them, like it doesn't help if you're, missing your kidney or something. So I'm going to do a quick checkup on you, make sure that you're okay. All right, get these gloves on because you're a little bit bitey, and then we'll search your person. You're going to be okay. You're going to be just fine. I know. You look judgy. Even in zombie form, you look judgy. There's no time for makeup in the apocalypse. Let's figure out where you came from. Alright, yes, these are not your standard doctor gloves. These are really big and heavy because you are biting. Alright, what's this in your pocket? Well, this I'm going to need to not have gloves on for. Alrighty, what have you got going on here? If you find this note, I have become a zombie. No kidding. I was traveling through dimensions and got caught in this weird one where you have a zombie apocalypse going on. Please help me get back to my world. Thank you. Let's search your pockets, see what else you've got on you. I already took out, you were near this. I think you were traveling to one of my secret doctor friends. This looks familiar to me. So I'll give this back to you once you're all better. Looks like it contains some kind of essence that's only gonna rematerialize once you get back to your plane. But now I sound like a crazy person. And see, that's why I live alone out here. Because, what happened to my other glove? Partly because I'm a little flighty. And it's hard to trust other people once you have been in an apocalypse. I actually feel more comfortable talking to you all, to the zombies. So, and as soon as you guys get better, I send y'all on your way and hide so that y'all don't find me. Because people are more dangerous than zombies often. So that's what I've got going on here. And I'm talking to you because in this form, you're not going to remember a lot of what I say. And it's lonely to not talk to anybody, right? It gets kind of lonely. But anyway, you're a dimension traveler. I'm the only person I know who believes in that kind of stuff. Everyone else around here, reality is reality, and that's it. There's just one reality. But I get you. So I'm sure as soon as I get you better, I'll give you that back, and I'm sure you know how to use that to get back to wherever you're going. So I saw that it's got some kind of secret agent seal on it, this card. It's very nice you have a thank you card. Like you already know that I'm going to make you better. That's neat. I'll get you back to your secret agent doctor or wherever it is that you're from. So I understand many realities because in real reality, I'm an actual physician. But of course, this is a secret reality visit. So everything I say here is just for your own self-care. Also, nothing I say here is gonna have any medical bearing in real reality. But I will assess you like a real physician because I am a real physician. I don't know if that made any sense, but it doesn't matter because you're a growling zombie, so you don't know what I'm saying anyway. You look so cute with the little decaying nose. You're gonna be unhappy with that once we get you better, but right now it's cute. Just a big old hole. Cute little monster. You don't watch those teeth. you're gonna need some real dental help once you get back out of here. All right, little one. First things first, let's make sure you're warm. I have this awesome blanket my grandmother knit for me. There we go. I'm just gonna tuck this in around you. Side here. All around you, even up to around your ears. Everything. All right, sweetheart. Let's get started. Let me just make sure. I'm gonna draw a couple labs, okay? And then we'll treat you with some little love pills. I have so many books here. Because, in the apocalypse. Like I said, it gets lonely when you can't really be around people. And I don't like people, so the problem a lot of you little zombies have is that in addition to the virus, most of you have already developed some form of severe cellulitis by this time. Because all your injuries and they don't get better, and sometimes people are shooting at you and so forth. Oh, look at that cute little bite. You are a feisty one. Watch it. So, we'll have to deal with that. I'm talking because it also helps me to think through things. It is disconcerting day after day seeing people in horrible states like you're in. It can be disconcerting, but and tiring, of course, very tiring. But talking helps me think through it all, of course. Alrighty. Think. First things first, labs. My lovely little biological specimens box. It's even got the little, I don't know, I lost something somewhere along the way. Something up here. Oh, I've got a little bit of a cold. Thank you for asking in your growly voice. All right, my little friend. Need a couple of samples. This is for urine. You already have a catheter in, so I'll just collect from that. I know that's the most disgusting thing. If you want to be scarred for life, put a catheter in a zombie. It is the worst. But urine samples are helpful. That way I can assess urinary tract infections and kind of things like that. Some of your kidney function. Some of your function, of course, I find from your blood, but so standard little needle. See, it's not going to hurt you. Little blood draw tube, and then the little tube that it goes into. Okay. These two things go together like this. This lovely little thingy goes right on the end here. Okay. All right. Oof. Look at that beautiful black blood. Look at that. Just, I love it. So gooey. With zombies, you don't even have to put a tourniquet on before you draw the blood because y'all bleed so slowly. Alright, perfect. Alright. Got my little bottle. Basically, I need to see, all of you zombies, you always have really elevated CK levels because you're basically in a constant state of rhabdomyolysis. See, being a real doctor helps make this experience more authentic, doesn't it? I have to get this over here. this little box. It's a little forensic kit. Back before society collapsed, I used to be a forensic physician. But, oh, this is not my forensic kit. Better. It's my TENS unit. So I'm just going to connect this little electrical doohickey to you. Kind of helps sedate you a little bit. Zombies have a weird response to low levels of electricity. Wow, this cold is doing a number on me. Let me get you connected up on this side. Right over here, and okay. And then this side, right over here. It's just a standard TENS unit. We use them for pain all the time. But I find they really calm you guys down. Really help you all. So we'll package that back up. Back up, back up, back up, back up, back up. Just package this back up. Package, package, package. TENS, TENS, TENS. TENS, 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 TENS. TENS unit, TENS. This is my zombies only TENS unit. I'm just packaging the edge of it so that, you know, it stays connected to you. You've got it working, but everything stays pretty much in the box. I don't know if what I said made any sense to you, but that's okay. It doesn't have to make sense, does it? All right. Where were we? Oh yes, we've drawn your labs. Let's do a little more examination before we give you your treatment. All right, so as far as head injuries, I'm just kind of stroking, checking here, and then on this side, just kind of check here. All right. So no big obvious injuries. That nose, it's cute. It's cute. It's gonna be less cute as a human. Of course you're a human, but you know what I mean, sweetheart. All right. Big old hole in the cheek, that's obvious. Let me stitch that up for you. Yeah. Well, you're a little bitey. That one we might have to wait until you're a human again. So we'll do as soon as the blood starts to flow. We'll start to stitch it. I'm gonna wait on that one. Let's see. Because that would really be a bummer to get bitten right now. So you're already, even just touching your head is challenging, and stitching a cheek hole, so I'm sorry you're gonna wake up and find that. I really think a lot about the psychological trauma of coming back after being a zombie. I think about it a lot. So you'll be staying with me a little bit after. And I mean, that's another reason I talk to you all through the process, because I think having some kind of calming voice after all the gunshots and all the other awful stuff helps you transition back in a healthier way. I think anyway. That's what I think. Okay. Hey, I'm the zombie expert, so you're so good at showing me your teeth. They're so good. All right. So, but I'm not worried about your teeth. Bitten your tongue a little on that side. Not enough that anyone needs to work on it. I know. You're so good. All right. I'm gonna poke on your neck, okay? Your head is mostly in one position, but it's hard for me to keep your jaw from closing, is why I can't do the cheeks, but I can do your neck. Let's come down here on your neck. Okay, my sweet. Just like this. Just checking. What I'm doing is I'm going deep in here and checking in your lymph nodes, okay? So, and the back ones. So I'm going to skip these. But mostly I'm actually checking for injury. All right, let's look at this arm on this side. Just feel. This side, feel. I already checked you for chest wounds when we brought you in, but I'm going to check again. I'm just going to put my hands on your chest, okay? Make sure it's even rise and fall of your chest. Beautiful. Let's look around to the back. Just gently stroking your back. I'm just checking. Don't wiggle so much. You're fine. Just got to check for any gunshot wounds, right? Any injuries. So same thing, you still have bilateral rise and fall of the chest. I'm not worried about any kind of pneumothorax. I'm not worried about any kind of trauma to your chest or back. So we're going to find out when you wake up if you've got a ton of pain. So the problem is some of y'all can even have like almost broken spines and still be working and moving around. Granted, a completely broken spine, y'all don't move. Because this virus still relies very much on your nervous system actually functioning. So, but sometimes y'all have back injuries. But when I pressed here along your spine, didn't notice any step off. That's when a piece of your spine is like, bloop. When I press on it, nothing like that. Everything was pretty significant. Significantly in the right place. So I'm not worried about that. All right, let's check your belly, okay? Just gonna kind of press here. All right. Now I know you don't feel pain, but y'all always respond if there's something going on. I notice a twitch. So I don't think there's any reason to believe that you have any internal hemorrhage or anything like that I can't tell is there. All right, let me get my little, I'm going to run a little machine across your belly. Where is it? Where? There we go. This is just a little probe. The end, my machine is over here, obviously. I'm just going to pass this over your belly, okay? It's called a fast exam. I need to just make sure that you don't have any bleeding that I can't see. Yeah, my little ultrasound machine, isn't it lovely? It's a little unfortunate I have to have you kind of sitting up. These exams are better lying down. Just going to push here on this side to check behind your spleen. Check over here on this side. All right. Down here. And up here. Beautiful. Okay. I don't have any reason to believe there's any kind of bleeding there. So that's perfect. Let me just kind of rub on your leg real quick. All right, other leg. Alrighty. So I'm, pretty happy. I already checked the other down there to make sure there was no bleeding, and you got the rectal exam while you were not awake, just to make sure. I would not normally do that, but it's what we do with the zombies, just to make sure that you're okay. There's no internal bleeding. There was none, so you'll be okay. Okay, so I can go ahead and administer the treatment. As soon as my labs come back and let me know you don't have some crazy thing going on with your kidneys. So a lot of y'all wake up and have some form of kidney damage because of all the CK running through your blood from all the muscle breakdown. So there's a threshold above which I want to rehydrate you and aggressively rehydrate you before I give treatment. So if you're below that threshold of kidney injury, then I go ahead and start you guys and hydrate you aggressively after the dezombification. So that's why I do that. I know, isn't it neat me explaining all of it to you? You haven't had a real doctor treat you in the zombie apocalypse before. Okay? Alrighty. Next, I would like to listen to your heart before we move on. My quick sweep has kind of shown me in general not to be worried, but I'm going to go ahead and listen to your lungs. A lot of y'all sorry. Rails. It's been a while since I've had to talk to another doctor, so I used the terms wrong a little bit. Rails is what you have. Or really, not even that. It's really bronchi. Crackles is like if you have heart failure, like a little bit of liquid in it. Rails is like kind of a empty, wheezing, open sound. Hearing it like COPD. Bronchi is this like snoring, gross, snotty sound. Pneumonia. Alright, I'm listening in the back. Okay, nice deep breath. Beautiful. Alright, other side. Nice deep breath. Beautiful. Alright, sweetheart. Let's go ahead and get you started. So the first thing we have to do, why did I take these off? It's very silly. The first thing we have to do is get you some immunoglobulin. See, a vaccine is not enough. You have to have the immunoglobulin. Unfortunately, I have a bunch of little bunny rabbits here that I farm immunoglobulin in. So, and then I distill that out of the blood, and the immunoglobulin I can use for you guys. So, because it's not enough to have a vaccine. A vaccine prepares, this is more like in like hepatitis B or something like that. You've got to have an actual antiviral. Like once you've already have it, a vaccine is just going to help your body respond to it, right? It's not going to, a vaccine is like practice time for your body. It's like teaches your body to recognize something that's unhealthy, right? But if you already have the virus, your body can't fight it off like that. That's why we give the hepatitis B vaccine and other vaccines before somebody can get sick, right? So your body recognizes to fight it off. But once you already have it, it's a little too late. You can recruit that immune system with a vaccine, but that's not enough. Immunoglobulin is the gooey stuff that sticks to different antigens and gets rid of them. That was a terrible way to explain it, but it's more like the bullets. If a vaccine is the training program for the soldiers of your body, immunoglobulin is more like bullets to shoot the bad guys. Bullets that exactly and specifically match the culprit and stick to it, like homing bullets. Yeah, it's exciting. And then what else? So got to get some immunoglobulin on board, and then an antiviral actually attacks the virus itself instead of the antigens of the virus. I don't know if that makes sense to you, but it's I guess if it's not like the bullets, an antiviral, it depends on the virus, right? A lot of antivirals don't actually go for the virus itself, but go for the cells to prevent in your body, like Tamiflu affects your cells so that the virus can't get into them anymore. It messes with one of the little signaling pathways. That's why Tamiflu is only useful within 48 hours of the flu. After that, it's pointless because it prevents that virus from moving. So, which is different than how like the anti-herpes medication, like valacyclovir, acyclovir, those work a different way. HIV antivirals work yet another different way, usually interacting with things like CD44 and other little signaling pathways. Different antivirals work different ways. So for the zombie virus, what I have found, similar to the rabies virus, I have to give you a ton of vaccine right in your belly, so hurry about that, and a lot of immunoglobulin, that's going to go right into your veins, okay? I have been developing an antiviral that seems to work very well. It goes directly into the, it was a little bit difficult to develop, bottom line. I don't have a lot of resources at my disposal. I have rabbits, I have a very small lab. It's not very easy, but Similar to the way that, this is very hard to explain. Let's get started on the other things, and then I'll figure out how to explain it to you, which I'll have to explain it to you anyway once you're here. So, let's get these shots all lined up for you. I'll get some relaxing sounds on so that while you're getting your shots, it's not too bad, okay? All right, ready? Go ahead. You're going to go ahead and start the fire. Okay. You hear that? Isn't that awesome? All right, fire, fire, fire. All right, really tiny needle here. Well, that's not so true, but if you look here, and obviously this is sterile, this is closed inside there. I don't know if you can see, there's a little needle in there. See it? All right, pop the top. Perfect. All right, and let's get started. Inject here. All right, same thing on the other side. I'm gonna pop the top. There you go. And then here we're gonna pop the top. Deep breath. Pop the top. Deep breath here. And pop the top. Deep breath here. Pop the top. Deep breath here. All right. Excellent. So that we got our vaccines on board. Let me get this IV going for you. Well, it's already going, but let me get the immunoglobulin on board. Your lovely IV is hanging right here next to you. So, yes, this arm was a little bit hard to, this is my drawing blood arm, and this is my other IV arm. So what I'm going to do on this side, I'm just going to hang an extra bag and hook it directly up to the little port. Have it in here. All right. I love the sound the bag makes. Just hang it right up on this side. Perfect. All right, so we got immunoglobulin hanging for you. Now let's get your antiviral on board. This is the part where I very, very much wish that I had been able to find a way to make this injectable. I have not. I hate this part. This is why the gloves. So, and you have significant cellulitis in a lot of places. First, we have to get all of these into you. So I've developed them with love. As you can see, they have little smiley faces. Smiley face. Look at the smiley face. You can't see the smiley face. I hate these gloves. I hate them, hate them, hate them. But they have protected me from losing a finger. Look at the smiley face. Do you see it? Do you see the smiley face? Do you see? You can't see the smiley face's mouth. Look. Isn't that cute? See how cute it is? See, cute, 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 and pop! And you swallowed it. That's me getting the other one. Let's get another one in here. Alright, let's do it again. Ready? Smiley face? Nope, that's green. We need a red one now. Ready? Smiley face is on its way. Smiley, smiley, smiley. Alright, we gotta actually swallow it. Come on, little one. And boom. Perfect. Perfect. Very nicely done. This is gonna take a while. So, I had to put this together with some herbals. This isn't Resident Evil, but, and these are not purely herbal, but I noticed that there were some plants that were helping with, you know how we discovered some of our heart medications from flowers, right? And there's certain antivirals. Oh, boop. Perfect. There's certain other antivirals that have come come to light. Did you know that aspirin came from the willow tree, the willow bark? It was a plant. It's very silly how we forget that we've developed these things. These things originally came from nature. Nature has everything you need. You just have to learn how to use it. All right, another green one, ready? Very good. Our anticholinergic medications come from a paralytic that comes from a plant, from the sap of a certain tree, actually. Yep, perfect. So, I noticed, and our heart medications come from a purple flower that will kill you if you eat it by itself. So I noticed some my little rabbits that were grazing in a certain patch. They would get better even after getting bitten. So I started trying to develop that. The problem is that this plant is severely lethal in overly high doses, so it took a while to find a rapid solution. But essentially, it's a fairly effective antiviral. Obviously, but it only worked, I found it only worked once I got the vaccine and the immunoglobulin on board. It seems to have some properties similar to like the Tamiflu I told you about, preventing further infection of certain cells. But the major thing that it does is, oops, well, that one's gone. That prevents viral replication, obviously. If the viruses can't get into the cells at all, they have a problem. Another one for you, lovely little pink one there. Fortunately, I could only I couldn't find a way to deliver this that wasn't PO. It's very difficult if you don't have a, you need an actual, I need a full pharmacy. I don't have a full pharmacy, not even a pharmacy. I need an industrial complex. So, all right, just a couple more and then you'll be right as rain. But it seems to me that in addition to preventing viral replication, because of some of the sister compounds in the plant, it actually targets the virus itself for destruction from some of your immune system without hurting and the problem is this could really damage your nervous system, since it's your nervous system is what's harboring the virus. But I managed to kind of weaken the formulation enough so this didn't just kill zombies outright. It actually, in combination with the vaccine and the immunoglobulin, actually works. So I'm pretty proud of myself. But like I said, I don't want anyone to find me, because humans will turn everything into some kind of, I don't want to be kidnapped and held hostage for cure, and people only let people access me. Medical systems are terrible. I hate medical systems. I don't like working for money. I just want you to get better, and then if you want to give me a chicken or help me around my farm before I blindfold you and take you away so you can't find me, that's fine. But the last thing I need is a warlord making it so that some people can't access me and other people can. I would rather, and I guess maybe I'm the one doing it. I'm making it so some people can't access me. It's a little silly, isn't it? Resources are limited, but at least I have control and I'm not somebody else's slave, and I'm safe. And I can make as many of you better as I can. I'd like to create a whole team. I'd like one day maybe for some of you to stay on and help me capture zombies and make y'all better. I'd like to meet another scientist so I can weaponize my treatment, so that you could just be shooting zombies and they could just get better. But unfortunately, we have what we have. I'm excited. I'll see you tomorrow. I'm gonna be so much better. You're already starting to feel a little better, I can tell. Starting to calm down a little bit. You just close your eyes. I'm gonna get those antibiotics on board. and we'll go from there. All right. Good night, sweetheart.